All right, y'all. Welcome back. You've made it to the last leg of PCI. So congratulations, yes. Oh, yeah. It's okay. It's all right. We'll be together the next couple days. It's fine. And also, there's a few other things happening, so you all will have a couple of other opportunities to connect as well. So, all right. Any feedback on the pod activity, the pod mapping? Yes. No. No. Quite often, in this work, it's sometimes difficult to find the networks that are in alignment. So, coming from Chicago, we have a big homelessness issue, and there's a lot of different groups involved in that. So, there are a lot of networks, but then getting people connected in closer circles is difficult. So, that's not abnormal at all. Any other things that came up? Anyone get an idea of someone they might be able to connect with? No? Okay. All right. Well, maybe with your team, that might be something you might want to discuss. Often I ask my team, what are some non-traditional networks? So in Chicago, we're really dealing a lot with the asylum seeker situation, and we've had a lot of churches and individuals ask for ways that they can get involved and provide housing. So for me, working for the government, I can work with the city and developing some networks there. So it's important to look at also maybe non-traditional routes for support. All right. Okay. So we are going to try a role-playing exercise. Full disclosure, I did not try this beforehand, so we're going to see what happens. Every one of you have a card. That is your role for this activity. And your table is your team. That's your team for this activity. So let's see. Does everyone have a card? I don't know where my back table is. You don't have a card? Okay, raise your hand if you don't have a card. We have a lot of papers and a lot of situations happening, so check under your packet first. And for my table in the back, how many? I see 1, 2, there are possibly 3 people still there? Well, for this activity, we need you to have a team. We need you to have a team for this activity. That's why we were asking. Oh, so y'all gonna do a dynamic duo? Okay, alrighty. Okay, all right, yeah. So maybe right here. I think you might be good. Okay. I mean, look at me. Look at yeah, so you have a role, and I'm gonna read out the scenarios. And like I said, I appreciate y'all's grace. We're gonna figure this out. But everyone has a role. Some of you may have multiple people with the same role. So there might be 2 funders in a group. Yes, take your card with you. Thank you so much. You are the best. If I had another bracelet, I would give it to you, but someone took it away from me. So, and so you're going to have some time to really practice what you might do in this situation. How do we work across sectors? How do we work with people with different experiences, different values, things of that nature? So, this group is going to be Group A. So Group A, your scenario is a funder is looking to support an organization that is providing innovations and housing and healthcare services for those experiencing homelessness. And your coalition is pursuing this funding, but is struggling with staff capacity. Okay, got it? Fun times. All right. Let's see. And to my left here in the front, you're going to have B. So you are part of an advocacy group that is designing a flexible housing and healthcare proposal for your city. Currently, the city is receiving a large amount of asylum seekers and have prioritized this group. The city already has a large amount of people experiencing homelessness. Back left, you're C. You are a part of a coalition that would like to integrate more voices of individuals with lived expertise. Your group has some equity issues regarding power dynamics, however you define that. And last but not least, my group on the far right, you are D. You are part of a racial equity group for a housing collaborative who has been tasked with creating a DEI plan for the collaborative. So, you got 20 minutes. So asylum seekers essentially are folks who come to this country seeking asylum. So right now we have a lot of migrants coming in, particularly from Venezuela. They're essentially trying to leave persecutory states. Is that a good definition of that? Okay. Oh, mental health asylum. Very different. You're right. Thank you. Context matters. So I'll be walking around if y'all have questions, but yeah, you got 20 minutes. All right. I know that you all figured out the solutions to all of these in 30 minutes. I know you did. I believe in you. So I am eager to find out what solutions you came up with. So I hope you're ready to share. Let's see. Who would like to go first? Oh, okay. Yes.
Hey.
All right, Kevonya, yeah. we got some. Do we have some bracelets for that group? Because they were just like, we ready.
Yeah, we're going. We're fired up.
All right.
We like to go. Well, I do.
All right. So
get it over with.
Can you let me know what letter you all had?
We were letter D.
Letter D.
Yes.
So you're a part of a racial equity group for a housing collaborative who has been tasked with creating a DEI, diversity, equity, and inclusion plan for the collaborative.
Okay. So we kind of went in steps, thinking strategically about how we could be successful in this project. So our sort of step 0 was to make sure that everybody who's at the table making these decisions is an adequate representation of the community. So first of all, we all had our labels, of who we were, but that
Who did you have in your group? What roles?
We had a couple researchers, we had a healthcare provider and an intern, we had a wild card,
okay, who
funder, and a program administrator / government.
Okay.
Yeah.
What was the wild card? What role did you all decide on?
Lived experience.
Lived experience.
She was
okay.
our lived experience.
Nice. Okay.
Yes. So we wanted to make sure and ensure that the table was representative of the community because, it's what we've been talking about and that's important. Yeah. Hello. Yeah, because DEI. So once we had established a group that was appropriate, then we decided that it was important that that group go through DEI training for the needs of the community. So as we discussed at length, all of our communities were different and it means something different in each community. So whether that means bringing in outside trainers or having an expert at the table who was going to educate us on what that means for our community, it was important that everybody was on the same page about what it meant to have a DEI plan for this particular collaborative. Then we would conduct a needs assessment. We would make sure that we were working with areas of the community that we were looking to I'm trying to think of another word than target. Target is, we decided that was not the right word, that we were focus on. That we were going to focus on to ensure that everybody, again, was well represented in the needs assessment. Once that was done and we had the data from the researchers, they would bring it back to the table and show the outcomes of that needs assessment, and we would come up with a short-term and long-term solution for the collaborative. So first of all, we would create a pilot within our housing collaborative of the changes that were needed based on outcomes that we had decided ahead of time. So if we were underrepresented underrepresented in the housing collaborative based on the needs assessment of the community and the demographics of that community, we would make sure that we would work with those communities to ensure that those folks were better represented in our housing collaborative. Once that pilot was completed, again, we would do a second needs assessment to have secondary data, like sort of the finish of the pilot data, that we could then use to influence longer-term change in other housing collaboratives. So that's, yeah.
Okay.
Yeah, so there were a lot of details associated with all that we discussed, but this is sort of our general plan for short-term and long-term solutions to make sure that our housing collaborative was well represented from the community.
Okay, thank you for that.
Okay.
Good job, y'all. Does anyone have, we could take 1 or 2 questions for that group.
You should apply for grants.
There's a recommendation. There's a funder over here. Yeah. And I appreciate the fact that you all had a very diverse group there, right? Like you had various roles, but it sounds like you all were able to integrate various aspects into the plan, which is awesome. Yep, absolutely. And that is very real. So thank you so much. Good job, y'all. Who wants to go next? Okay. Well, y'all. Just because you said don't look at y'all, I got it. So, you all had B, correct? So you are a part of an advocacy group that is designing a flexible housing and healthcare proposal for your city. Currently, the city is receiving a large amount of asylum seekers and have prioritized this group. The city already has a large amount of people experiencing homelessness. So I know this was a challenging one. Let's start with roles. What roles did you have within the group?
Care provider.
She said, step up, step back. All right.
I respect boundaries. I respect boundaries.
Okay, so I heard healthcare provider. And that is a very real, very complex situation. We're talking about policy. We're talking about values. We're talking about not having the right people at the table or all the right people. A lot of issues there. Thank you all for really engaging in these very difficult conversations and figuring out solutions. So, oh my goodness. I wanted to cover imposter syndrome because I know that was mentioned before. So I'm sorry, it's a little out of order. But I think that comes up in this work too, right? If you are the only BIPOC person or someone from a traditionally marginalized community, feeling like you are not what other people might see, right? Like, you're not the leader, you know? Maybe what'll happen if you mess up, or what'll happen if they find out that you're not capable, I think is very real. And you all have a worksheet there that kind of goes into more about imposter syndrome. I think that also from Therapist Aid is a great tool to use for talking with clients and things, but also something to reflect to see if it sits true for you. Or you may also see it on your teams, and how do we support people through that? So, yes. Yes. Yes, so imposter syndrome is when I feel like I am fake, right? So I feel like I'm gonna get found out. So as a presenter, I may say, I'm not really a presenter, you know? People are gonna notice at some point that I'm not good at this. Yeah, so you know your reason why you're here, and you're confident in that. Sometimes when people experience imposter syndrome, they say, they discount the things that they've already done, the experiences they've already had, and say, maybe I'm not caught up. I'm not good for this, you know? Yeah, that's great. Not everyone has imposter syndrome, but I will say, typically BIPOC communities, we see a higher incidence of it. So I'm going to play this quickly. Maybe. Okay.
Mrs. Obama, could we quickly touch on imposter syndrome? Because I know it's something you have spoken a little bit about. There was a question from one of our leaders from Indonesia, feeling you're not good enough.
Yeah, how many people, this imposter syndrome, does everybody know what we're talking about when we say imposter? It's like,
I don't really know that term.
Well, particularly for minorities, you know, there's this feeling like, because you've been told that you're not good enough, that when you're in a room, you're wondering, well, how did I get here if I've been told I'm not good enough? Women feel it oftentimes because society says you shouldn't be doing that, right? So you feel like an imposter in your own life. You feel like, especially if you've achieved success or you're in rooms that you're not supposed to be in because society has told you that, you think maybe somebody's going to discover that I shouldn't be here, right? That's imposter syndrome. Does that make sense?
It sure does.
So, what I tell people is, okay, you know, and all I can do is tell you this, because imposter syndrome it's a thing in your head. And, you know, it's just like self-confidence. It's just like, you know, it's like any internal characteristic. Much of it is what you practice telling yourself, you know, and if you've heard that you're not good enough, that's what you're practicing. I'm just here to tell you, it is not true. You wouldn't be here, you wouldn't be doing what you're doing if you didn't belong here. And I also have the advantage of, and I say this not with any level of arrogance or lack of humility, but I've been at so many powerful tables now, right? I've been at, you know, I've worked in every sector. You know, I've been a lawyer at a big law firm. I've worked in an academic university, been associate dean. I've been the vice president in community development at a hospital. I've been, you know, I run a nonprofit organization. I worked in the government. I worked with the mayor in the city of Chicago. I worked in the Department of Planning and Development. I was First Lady of the United States of America. I've seen these seats. I've served on corporate boards. I've done it, not all, but I've done a lot. And I'm just telling you, there are a lot of people who don't belong there. And every table I thought it was me. And after a little bit, I'm like, nope, it's him. It's this guy who's sitting here talking.
But they
all the time. That's because they've been told they belong there. They don't. But there's a presumption. That's what I'm saying. It's in his head too. He's like, I belong here. I'm like, nope, you don't. So all I can tell you is that the person sitting next to you was told, based on nothing, that he belongs there. And you were told that you weren't. Both things are wrong, oftentimes. So what I had to learn to do for myself is age helps you with imposter syndrome. So I'm 55 now, and I've seen it. I've been waiting to be as bad as people told me I would be, you know? I've been waiting for when I was gonna fall and mess up and fail. I've been waiting because that's what they said. I didn't belong at Princeton, right? I applied to Princeton University. My college counselor said, you know, that school's too much for you. Well, I applied anyway, I got in. I was waiting for it to be hard and for everybody else to be so much smarter. They weren't. They weren't. They were just told that they belong there. Same thing was true when I went to apply to Harvard Law School. Maybe I shouldn't be there. Got there. Nope. They're not any smarter than me. So with all the practice of just going into the room that you weren't supposed to be in and being there and occupying those seats and just doing you and knowing that your thoughts are just as relevant, your experiences are just as important, your insight is just as valuable, so that you will share it and use it and practice being there. That's the work you have to do if you feel like an imposter, because he isn't giving up his seat easily. He isn't gonna just say, oh, I understand you don't feel like you belong here. Well, let me make room for you, sit you down, tell you the things you need to hear. They're not going to do that for you. Because a lot of times they don't even want you there, even when they need you there. So you can't count on somebody else giving you the self-confidence. That's not how we work, you know? And that's why you all are important, because you're not going to do that for some kid in your life. You're going to make sure that they never feel like an imposter. You're going to help them practice a different set of messages, so they aren't sitting here wondering where they belong in places where we need them. We need women and diverse minds and people who think differently and have different religious beliefs, because truth and the right answer comes from diversity of experiences. You know, you're needed at those tables, so you can't sit there wondering whether you belong, because you'll waste your time in those seats and you'll hold your voice back and you won't be able to make change because you're waiting for somebody to tell you that you belong. I'm telling you, you belong. Practice a different set of messages.
Thank you for saying that. So important.
Yeah, I mean, I really can't say anything after Michelle Obama. So, any thoughts? Yes. What really sticks out here is, to me, the fact that the more we show up in these spaces and do the hard work of putting ourselves out there and pretending, even if we don't feel it, that we should be there, the more we start to believe that. You Right. So part of this is trust. Trusting that, hey, I might not believe this right now, but I'm trusting that there's something for me here. There's something for me to do here. And I'm going to see what happens. And I think that's challenging, but as Michelle Obama stated, there are plenty of people at these tables that have no business being there. It was, yeah. I used to think that before I became an administrator, and then I said, oh wow, like there were no words to it, because it wasn't because they were smarter, it wasn't because they had more experience. They were just there. They got access to the room. Exactly. So yes. Yes, just showing up. Yeah, I see this a lot in working with lived experience groups. A lot of folks will say, well, I don't know the language. I don't speak this language. I'm not going to sound eloquent. And I tell the folks who want the lived experience folks to speak up, then you all have to create space for them. There has to be you listening and then saying, help me understand this, instead of you need to speak like we speak. So I think it's important to just speak your truth and be there and have allies in this work too. But also, the more that you're there, the more you pick up on certain things too. And quite frankly, I have learned in certain spaces, I don't code switch anymore. Like, I say what I said, and you take it or you leave it. If you didn't get it, I'm sorry. That's on you. But I also, when I do that too, I also think about if I don't speak up, then what happens to the people that I'm serving? Yes.
Like along that with that, like we need to be getting support from somewhere.
Yep, exactly. Yep. Yes. Yes.
We can do that for a little while by ourselves, and then it becomes incredibly challenging.
I have been blessed in that I have a supervisor that mentors me, right? And believes in what I'm saying. I mean, partially because she's like, I don't really know this housing thing. So there's a trust factor. But her trusting me there really helps me build that confidence. And you're right, we do need that support.
Can I just say you gain the trust of your supervisor so you have that support? You've shown up in those spaces, so we have to show up, and we kind of have to fake it till we can make it, but we have to show up and be present so that the other folks in the room
Yep.
understand that we're not going away, and we're gonna keep working at this till you understand where I'm coming from.
Yep.
So I have to work at that. We can't get tired of it back on this.
Yes, yes. Wise words there. Anything else? Okay. Okay. Oh, Albert, go ahead. Well, thank you so much. I will say this is my first all-day workshop, so. But I appreciate every single one of you because you bring so much wisdom, so much power, and I was telling Kevonya and Elena, if you all get a safe space to be, then my job is done here. So thank you all for creating this space. Kevonya, Elena, any parting words?
My parting words is I actually struggle a lot with imposter syndrome because I'm constantly told I am not supposed to be somewhere. And in my life, when I've tried to make that step and think it until I make it, I haven't succeeded. So this is my first director position. Although, like, when I present, nobody would know that, right? Like, people are like, yes, you're on it. And I was just like, you don't know how much I'm struggling on the inside. And as Michelle said, the older you get, I realize I'm just like, no, I know what I know, and you can either take it or not take it. And when those imposter messages, which I also call my wounded self narratives, come up, I reject you.
Yep.
I'm like, you no longer serve me. And that's why in the mirror, I reject you, you no longer serve me. I'm like, and I know this is being recorded. Fuck you, fuck you, fuck you.
Yes. So just as we're interrupting systems and institutions, we need to interrupt that thinking that says we're not good enough, we're not worthy. Thank you for sharing. Elena?
I'm grateful for you all. I've been doing my own self-care over here, and I needed it coming to this conference because I was tired and burnt out. So I just want to say thank you for this space and listening and sharing. Just grateful for you all joining today and being vulnerable and sharing with us today. And, I didn't know how successful this was going to be after it seemed like at our conference people were looking for this space, so I'm just really glad to see it kind of executed and done well. So thank you, Chante.
Don't make me cry. Don't make me cry. Thank you all so much. And like I said, it's really, we got to trust one another too, right? Elena, Darlene, Kevonya, they put some trust in me. And that helped build this space. So any way that we can uplift one another can be quite powerful as well. Yes, where is it? There we go. So, do you want to talk about the affinity group?
So,
So part two, Wednesday.
Is there any possible way that you would have been videotaped? What was written at that exact same time?
That one is not video. The private sessions are not video. And don't worry. So one of my projects on the council is to create a monthly support group for all people doing this work. And you're in Seattle.
Nice.
I am in Seattle. But when I do the national day, it'll be via Zoom so that anyone across the country can be able to attend. Because when I show up in these spaces, the one thing that I constantly hear all the time is like, how do you manage the emotional labor? How do you manage the emotional labor of doing this work? And let me tell you, I am not a unicorn. After my last organization where I built an EI program and did all these wonderful things, which even though I have not been there since last October, is still going, which is a testament, right? Because it wasn't about me, it was always about the work. When I left, I went on a 3-month medical leave because I was emotionally done. And so I'm all about, and that's the second medical leave I've had to take in my 19 years. So that means, although I've gotten way better, because it's been 12 years between those two medical leaves, there's still work to be done. So I want to make sure that I am getting support and also modeling, right?
How do we get information about that?
You're actually going to get a push notification. It's going to be, if you have the app, you're going to get a push notification the Wednesday morning being like, don't forget, join Combine this BIPOC affinity group.
Nice. And then for the Zoom group,
For the Zoom group, I'm with Chante, so I got access to y'all emails. I'm going to be sending y'all emails when it gets when I make it happen.
We have a registration list.
yes.
Can I just add a point of clarification? Breaks were not recorded.
The breakout sessions were not recorded.
During breaks.
Oh, no. Yes.
And I think because the parts that are, because when it gets edited, the parts that are going to stay is Chante talking, but when we did our group work, that is not supposed to be recorded.
That's right, Jay? That's correct? Oh, all right. Jay's like, it ain't gonna be on me. And I do want to show appreciation to Jay. He's been making sure our sound is great and getting the room all straight for us. So thank you, Jay. Any other appreciations you want to share? You can feel free to share with each other. Oh, wait. I hear so many people. Hold on. Jay? Thank you. Appreciation to you all. Thank you. Albert, did you have Yes. And I hope each of you has something to take away here. You gained something. If you can go to Menti, I don't know, you could try to click, or you don't have the PowerPoint. I'm sorry, y'all. I'm used to doing this virtually. If you can go to this link and put what meaning you're taking away. What are you taking away from this experience?
I say take a picture with your phone and so you can access it.
Thank you.